All right, good afternoon, everyone. I'm Chaitanya Chensalpadi, Head of Customer Success at ekincare. Welcome you all to the monthly webinar series powered by ekincare. Today's topic is going to be very special as it is a very relevant topic to every leader across industries managing their wellness portfolio for an entire organization. The topic that we'll be discussing today will be the future of employee health and how data-driven insights are reshaping the healthcare benefits. To discuss around the same, we are sure you will be having loads of insights to carry back because we will be discussing with none other than Amit Lakotia, who basically is from Fidelity International, an organization that has been serving more than 2.5 million customers across the globe, helping them with their investment solutions for over 50 years now. Amit has recently spearheaded the organization in helping them win the prestigious Employees Wellness Benefits Maximizer Award recently. To give you a little more insights on Amit and his experience and expertise, he's an individual with more than 22 years of experience working across different HR domains like compensation benefits, HR transformation, people analytics, payroll, and HR operations, to name a few. He's currently working with Fidelity International as an associate director, and he's very keen in taking data-driven decisions and processes and taking automation as a passion, in terms of ensuring that there is efficiency in the system. He has also led implementations across the organization with keen digital transformation with tools such as Darwin and Workday, to name a few. He has been pivotal in the advancements of the products of our employee wellness and health to be implemented across the organizations. Amit, thank you so much for taking your time out and willing to share your learnings from the past and some insights for us to take away from this session today.
Thank you, Chaitanya. Thank you for that elaborate introduction. And I'm very happy to be here and share my experience with everyone.
Thank you so much, Amit. So we will not waste any more time. We will jump into picking your brain, Amit, for understanding more about this function and how you have really led it by the horns, right?
Sure.
My first question for you, Amit, will be: how have healthcare benefits evolved in the recent years, and what are some of the key trends that you see are driving this change?
Yeah. So in the recent years, there's immensely the healthcare domain has changed I would say, in the last 4 or 5 years. Just before the pandemic, that change started. And there were earlier days, like if I talk about 10 years back, it was very simple. Healthcare was very simple for people to manage. There were used to be the insurances like employee mediclaim, life, and accident insurance, and that's about it. That's all the healthcare. Some of the progressive organization used to have an annual health checkup also built into it.
Right.
But now things have changed, and in my opinion, there are a few things which are driving these changes. I would say the first is that the workforce is quite diverse now, right? You have, I would say there are almost 3 to 4 generations who are right now part of the workforce, right?
Yeah.
Every generation will have a different need of themselves.
Correct.
Plus the pandemic with this working from home thing, that has accelerated the adoption of all the digital innovations in the benefits space, right? So you have seen like healthcare apps like Yourself, Healthify Me, Fuller Life, Get Active, to name a few. Then a big players who have bought these small apps like 1mg, Tata bought them. Similarly, Apollo jumped into this field where to have an online presence. Then NetMeds, PharmEasy, to name a few. So this area has become a minefield for, I would say, for competition. It is like there's so many innovations are getting driven right now in this healthcare space. And then I talk about the other factor which is driving this change is that earlier I would say like a organization used to be like selling that we have a flexible benefits options, right? It used to be an EVP for organizations, but now, as I said, with the announcement of technology and easy adoption of that, people have now started experiencing the digital health services, right, on their fingertips. They can do tele consultations, and they can order a pharmacy, get diagnostics tests done at a very reasonable prices, highly discounted prices, right? Or maybe just book a virtual session free of cost, right? There are many apps who do fitness sessions virtually free of cost. Sitting at the home, people can do all that. So I would say that the ease of availability and the comfort which employees or people at large are enjoying, flexible benefit is no more an EVP. Now it is more of a necessity for progressive companies to have it in their portfolio of offerings to offer to employees. And last but not the least, the focus has also changed in recent years from physical fitness to a more holistic approach, which covers mental, emotional, and financial aspects also. So I would say these are the things which are changing in the healthcare front.
Absolutely, absolutely, Amit. Those are some great insights that you have said. One strong point that we take back, Amit, is typically when you said these are four different generations working in the same office right now, and the need of any one generation is not the same as the other. And flexibility and comfort of ease of using this is basically transforming the entire business right now. Great insights. Thanks for sharing this, Amit. That brings me to the next question that I have for you, right? What are the challenges that the employers face in using data-driven insights, right, to shape the healthcare benefits for the employees? And how, as a leader, running this program, how do you address these challenges that you face?
So I would say data-driven insights is a big thing to say right now, because I would say that data availability itself is an issue. So forget about insights and decision making. Sometimes if the data is available, the quality of data is not very reliable, right? So uh, we need to have required technical tools in place to gather the data, consolidate it, analyze it in a structured way. The next step, the next challenge which I see from organizations is that talking to different individuals, that uh, data is there, but they don't know how to use it, right? How to use it to make decisions. So all this, I would say, defeats the purpose of data-driven decision making. At the end, somebody like me sitting in a company, they will take just a decision based on their guts because there is no data available, or maybe they take it based on the feedback, which may not be a very right approach, because feedback could be very selective, right? I may, as I said, diverse workforce, different needs. I have different, you may have different. So it is data which will need it to be there first of all. So and 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 with data, it's not only the data-driven decisions which one should take. We should use some creativity also when we design our benefit, right? So I would say that the organizations who are thinking to start on this journey, or have just started, the first step for them should be to consolidate all these sources of healthcare data or any other benefit data which they are looking at, to consolidate so that they could spend less time in collating, reconciling, and analyzing this, right? There are
Absolutely.
very exciting tools available right now in the market to do that, right? I will talk later about a tool which I just experienced 2 days back. It's a very exciting tool, right?
Okay.
manual effort goes back.
Mhm.
But to just to keep it to limit it here. So once you have consolidated your data, the next step is to invest in technology, right?
Mhm.
To so that the data could be captured in a structured way.
Right.
And that investment in technology, I don't mean that you need to buy a big server or set up a team of people. No, don't you don't need to do that. And the scale of the investment will depend upon company to company, I would say. I would say that if the remit is only limited to, let's say, to India, then you
Mhm.
don't need a technology server database being created in-house, right? There are many vendors available in the market. People can just survey the market and they are happy to work with the organization, provide the BAU benefits or the new benefits, whatever the requirement is, and in return exchange their infrastructure to host their data in a structured way. And by doing that, they have the right expertise also to provide you the data insights that what you should look for,
Mhm.
right? And they can guide you. They are the experts. If that expertise is not available in house, then use that expert. And even if the expertise is available, there is an outside view which helps always. So I would say that talk to your well-being partners or look out in in the market, do a survey. You will find vendors who are willing to lend that infrastructure in exchange of the normal BAU benefits which you offer to your employees. That will help you to generate dashboards, reports, and once you get the data in a proper visualization format, Chaitanya, it becomes very clear that
Absolutely.
okay, what you want to do, right? It just makes the decision making and very easy.
Absolutely.
Yeah,
Yeah.
but I will be like quick to add that when you do this, when you look for somebody external to host your data, please do your due diligence and for data protection and sensitivity before entering into any commercial arrangement with them.
Mhm.
But yeah, there are quite innovative solutions available in the market who could just help you in achieving your uh, objective of making decisions based on data.
Sounds good. Sounds good. Those are some great insights, Amit. I would like to take this opportunity, right? When you clearly mentioned, even if you want to drive insights, gathering data and capturing it in a format that you can be using is the main key, pain point right now, right? At Taken Care, we have basically addressed this across all the corporates that we serve, right? There is a standard dashboard that is by default available for every corporate that is partnered with us. We call it the data sense. The data sense typically churns out always current data, like any component that has been utilized in the last 1 hour, you should be able to see it in terms of on the data sense dashboard without having to depend on a particular individual or a system or a tool, right? It's just on a click. Open the dashboard and the dashboard will give you insights. All the insights that you typically have on the dashboard are typically in terms of your utilization, experience,
Mm.
most used benefits, most used segment of your employees, right? In the previous point that we basically discussed, four different generations using the same set of benefits that have been rolled out to the employees, right? You would be able to understand which segment of your employee base is using which of the benefit most, and how are they enjoying it, what has been their experience in terms of rating of the experience of the service that they have been availing. So absolutely great point where you said you don't have to do this yourself. There are multiple partners who are skilled enough with a team that is skilled enough to basically churning this out for yourself, for you and your organization, for helping you take the right informed decisions on that.
Yeah,
Great point.
absolutely, absolutely. And yeah, I have seen the platform you have, Data Sense.
Yeah.
It gives fantastic insights, Chaitanya. I should congratulate you on that.
Thank you so much, Amit. That means a lot to us. Yeah. So with that said, Amit, my next question for you is how can technology and data analytics, and be helpful, be used to improve employee well-being, right? And what are the some of the practical techniques probably that have been used by the employers to leverage these tools effectively, right? Now that you have a tool, how do we use it?
Yeah, so as I said, that once you have the data in a structured format and having these expert tools available, like data science or something else, which is available in the market, it can help employers immensely because when I look into my data, it clearly tells me that, okay, for example, when I look into my preventive health checkup data, it clearly tells me that uh, what I need to do from employee well-being or an healthcare benefits perspective. So when you have this, it becomes easy to visualize and it becomes easy to introduce new benefits. It helps you in designing the benefits and it helps you in managing the budgets also, right? Because otherwise, like for if you have I'll again take an example of preventive health check. If you have one standard preventive health check test list across all people, you will be wasting your dollars because uh, nowadays I agree that the health you are hearing different kind of things, but normally speaking, you need to differentiate between, as I said, the three generations, right? What they need, what Gen Y will need, or what a Gen
Yeah.
Z. Right?
Yeah.
So that's just an example, right? And similarly, if you give, I'll give you another example, like Mediclaim, right? Everybody has, most of the companies have Mediclaim. You can get that data also from the TPA, or you can have that on a summarized level also from either your broker or your TPA.
Right.
So when you look into that data, so I am based out of Delhi NCR region, right? So when I look into my data, it clearly tells me that pollution is a problem, which obviously everybody knows, right?
Yeah.
But it is now started reflecting in the data also that my highest claims which are getting registered are related to pulmonary function. Right? So then that gives you uh, uh, an insight, I would say, that it gives you a clear data point that you need to have a good pulmonary function test in your health checkup package, right? So this is how you can connect them,
Absolutely.
or it could be a good data point to present to your leadership team that, okay, we need to install air purifiers in the office, right? Or we need to do awareness sessions related to breathing or pollution, etc., etc.
Right.
So this is just an example, right? Then then you said that I'll give you one more example. Again, related to Mediclaim. Few years back, we used to get a lot of feedback from employees, right? That the sum insured is too less. We need to increase. It's too less, too less. Okay. We said, okay, fine. Let's go to the data and see whether it is less or not. We are a 3,000 employees based company at that time. And when I looked into the data, only 3 people crossed the sum insured.
Okay.
Out of 3,000, right? But it was because of the psychological thing that, okay, no, this amount is less. We need to increase. We need to increase. So only 3 people crossed it. And those 3 were also covered from our corporate buffer, which we had some extra element in our policy to cover such cases.
Okay.
Now it is easy for me for people to say increase it, but when I spoke to the insurer to increase it, they will obviously ask additional dollars for it, right?
Absolutely.
But then there is no need. You may say that, okay, it may not be a need today, may what happens next year. So I didn't look into just 1 year data. I looked into the 3 year data. That how the trend is of the I would say max claims hitting the limits. the trend did not tell me that I need to increase sum insured. So we didn't do that. We presented that data to the leadership, and then they also understood that you don't need to do that. So when we analyze the data, it gives you a fair indication that the effectiveness of a benefit or any correction is required or not. Similarly, as I said, look into your preventive health checkups data, even a simple HRA data, right? You could, when you analyze it, it will tell you a story that what's going on in the healthcare side of employees.
Absolutely. These are great examples that you have brought up, Amit. Specifically the last one that you've said, right? The noise that you hear versus when you actually look into the data, there is absolutely no correlation or, probably a link between them, right? So a very key takeaway is what it appears to be a perceived need or need not necessarily be something that you have to action upon. Always take data-driven decisions because at the end of the day, the data doesn't lie, right?
Yeah,
So,
and if you are hearing noise, share
hmm,
that data with the employees, right?
hmm,
That why you making that decision. Share
hmm,
that data. They'll appreciate it.
absolutely. Yeah.
They'll and there's nothing like to be hidden. I would say like this
Yeah,
business of not sharing information with employees is not will not give you the desired result as
absolutely.
compared to when you share it, keep it transparent. It
Exactly.
employees will appreciate it. They will understand that why the company is taking that decision.
Hmm. Great point there, Amit. Definitely something that I have noted down and going to follow right now. Well, then that brings me to the next question that I have for you, Amit. How can employers ensure that the healthcare benefit packages, right, and are basically tailor-made for the specific needs of the employees? Are there any best practices that in engaging the employees that you have followed that you can basically share with us?
Yeah. So as I said, that workforce is very, very diverse, right?
Hmm.
Uh, I was reading a survey a few days back. It said, and I was surprised with that 25% of the workforce now includes people from Gen Z. Okay. So that was, I was like surprised that, okay, people who are less than 25 years are now 25% in the workforce.
Mm.
So, and these people have grown in a very different environment, right? They
Yeah,
have not seen what their previous generations have seen, right? They
absolutely. Yeah.
don't know what is a, they may not be knowing what is a video cassette, forget about a tape recorder cassette, right?
True.
So they would not have seen those big floppy disks which we would have seen in our times.
Correct. Yeah.
Their requirements are completely different, right? They and and similarly, if you look into the Gen Y, right? They may give a different, they have a different preferences. They will look for childcare benefits more.
Yeah.
Baby boomers may look for medical benefits, retirement benefits more, right?
Mm. Mhm.
While these new people less than 25, they may look at a preventive health checkup more.
Correct.
They may look for things, they may want to design their own benefit package, right? They
Correct.
may want to be flexible that, okay, I don't need to, I need more cash in hand. I don't need much benefits, whatever the choice may be for that individual.
Absolutely. Absolutely.
Those are quite different people than what the Gen Y and baby boomers are. So there needs to be a flexibility in the systems, and whenever we design our benefits offering, we need to keep that in mind, that flexibility remains, and managing budgets always, right? Because
Absolutely.
that's where creativity comes in, that how you manage your budget. It's easy to give, but to be little creative and manage that budget, that's where the dollar is.
Absolutely.
So yeah, and so to your other question, sorry, what was the second part of your question?
So how do you ensure that there are what are the best practices that you basically can probably adopt to in engaging the employees in this process, like making it tailor fit for them?
Yeah, so I would say that the traditional way of doing things, getting done the employee survey, be it internal, external, External surveys also nowadays are quite innovative. They provide you very good insights.
Mhm.
So you could get that input from those those surveys. Then you could form small teams within your organization, right, based on the individual interests of those teams. It could be cross-functional teams, committees, and let them be the champion for a cause, right? That okay, if benefit is employee benefit is something, then let them come up with a proposal that okay, this is not something which company is offering, and there is a requirement for this, or there is a need for this. Can we do this? If there could be like well-being champions, right?
Mhm.
Uh, who could say that okay, we need to organize. Let's say they may say let's have a Zumba session in office, for example, right?
Mhm.
Let's have more like have a stepathon. Let's have a week of doing activities of well-being.
Mhm.
So
Mhm.
these are the different ways where we can engage employees in the process and get inputs from them uh, in designing your well-being and benefits packages.
Great point, Amit. So I would want to add, a little more there. Right now, in the recently, just a couple of quarters ago, at the beginning of this year, right, we have done a joint exercise along with People Matters. Right, we have run a survey across 900 odd, close to 1,000, corporates across Pan India, different sizes, various sizes across, various industries. Right, in understanding more insights about the leaders on and their vision about health and wellness benefits for the employees going forward. It was pretty surprising and in fact fascinating and happy to see the results come out. 80% of the corporates have responded back saying that customization of the benefits for the employees is their priority for the upcoming year. They have heard the employees across various generations that are working on the same floor on the office, right? Everybody's needs are different, so the leadership acknowledges the fact that a one size fits all and only one benefit that can be availed that can be rolled out for everybody is not going to work anymore, like how it was in the recent past, or probably I would say just before the pandemic, right? Everything has changed right after that. We have been basically offering uh, uh, different plans that can be adopted right across every organization of various sizes and industries based on the budget that they have for the corporates. So ekincare platform has been built in to keeping all of these points in mind, where it can be customized to at least 30,000 different levels with different options, right? Depending on the benefits that you want to basically enroll to the budget that you want to basically spend. So opportunities are many, options are unlimited on the platform. So more than happy to hear all these insights coming from you, right? How you have basically thought of all of these and design the plans for you where it is basically falling in line with what our thought process is. That's a great synergy that we have.
Yeah, absolutely, yes.
Yeah. With that, I have the follow-up question on top of it. I know you have answered partially, to some of it in the one that I have asked in the recent one. So, what role do you see that the employee engagement plan has in place in the success of the entire program that we designed, right? And how can employers leverage the plan that we have and improve the well-being and of the overall organization as a whole? It's not about an individual, right? How do we encompass the entire organization in terms of engagement so that collectively the entire organization grows?
Mm.
Mm.
Yeah, sure. So I completely agree to your point that where you said that 80% employers recognize that there's a need to have different offerings under the benefit and healthcare package. So uh, you would have seen, like you would have also observed in the industry that we are growingly hearing about different teams being formed, be it an employee experience team or an well-being team, right? These were not before, right? As I
Correct.
said, it was like one person was managing, okay, all the insurance is done, nothing else.
Absolutely.
But
Yeah.
now we have well-being team which is getting formed. We have an employee experience team which is getting formed. So there is this acknowledgement there that there needs to be, the employees needs to be engaged, because employers are also sometimes don't know that what the need is, right? It needs to come from the bottom, that okay, this is what we need, and then based on the data and different factors, the company can decide what they want to offer, right?
Absolutely.
So these, the new teams which are getting formed are creating more awareness, I would say, about all the aspects of well-being, which is physical, emotional, social, financial, everything.
Mm.
So I think to engage employees, the key factor is the communication strategy, right?
Yeah. Yeah.
People cannot engage with something they don't know.
Absolutely. Mm.
If we just send, so I get a lot of pushback throughout my career that, okay, we have already sent one communication, why do you need to send it more? So I get a lot of pushback.
Mm.
So if people do not know that there is something which is available, they will not use it, right?
Mm-hmm.
Uh, the messaging needs to be done in the right way.
Mm-hmm.
That could engage, that could increase the engagement multifold. I'll give you an example that uh, uh, some time back we did a webinar on some well-being topic, right? Now we just sent out an email. Okay, so on so and so date, there is a webinar. Please mark your diaries and and be there.
Mm.
It was, the participation was like less than 20 from 3,000 employees, right?
Right. Mm.
So we said, no, this is not going to happen.
Yeah.
Next time when we did the webinar,
Mm.
again a different topic, although a different topic, we sent out a calendar invite.
Mm.
The participation was 200 plus.
Mm.
So that is the difference, which we are doing the same things before and after also, but the communication needs to be right.
Mm.
Right. So that could increase the participation multifold.
Mm.
We put a lot of effort, energy, resources on designing a benefit program. We put in all our creativity also, we use data also. But if it is not communicated right, it is not going to work. Correct.
Yeah.
So better to over communicate on benefits. That is what I have learned over the years.
Absolutely.
As we have an EAP program, right, for years now.
Mm-hmm.
Just today I got got a message from somebody in the organization that where can I find the hotline number?
Mm.
See, so and we communicate. It is not that we do not communicate. We communicate, but still people don't know about it.
Mm.
And it is similar. Like if I receive something which is non-HR, I may read it, I may not read it, right? So I may not know, okay, this is available. So it's always better to communicate.
Absolutely.
But and now with the advancement of technology, Chaitanya,
Mm.
best thing which I like is the push notifications.
Right.
If you
Mm.
have an app,
Correct.
then the push notifications can be a good medium to engage with people, right?
Mm.
I find them very, very effective. But yeah, you need to have a technological infrastructure or an app to do this. The
Absolutely.
other way is, as I said before, be transparent, share
Mm.
the data,
Mm.
share the claim ratios of your medical insurance, right?
Mm.
That will that will help people know that okay, the premiums have increased, why they have increased,
Absolutely.
right? So they'll all appreciate all this. So these are the, I would say these are the different ways to engage employees and to make them utilize the benefits more effectively.
Absolutely. Yeah. You had amazing insights on this, Amit. You were spot on with everything that you mentioned. I was like so amazed with you mentioning each and every point in such a detail, right? It resonates with the thought process that we have here, correct? So we believe the same, right? Health is very basically very personalized and private for each and every employee, and out of sight is out of mind for them while you are communicating it to them, when you want to. But if that's not the right time for them to take a look at it, they will ignore it. But when the time is right, they will probably have to run from pillar to post to find what it is, right? That's exactly the reason, we basically engage AI driven tool at the back end, only for the need of giving every employee a personalized journey experience, right? Your health is in your hands. Employees of the same age of different genders will have different needs, that they want to basically engage with, on a platform like, which relates to the health and wellness benefits. It is not like your Amazon that you want to basically log in every day and
Yeah.
probably browse, do the for shopping, right? It is, when you need it, it has to strike that you have this benefit and there is a place that you can go to and you get it immediately right there. So, a journey designed based on multiple parameters, age, genders, locations, and multiple other, segments that we have, helps us basically in constantly engaging with the employees and giving them the right information at the right time. At the same
Yeah.
time, we are basically very cautious about ensuring that it doesn't appear as spam for the employees, right? Too much of information coming on their way about multiple other things, we typically, at the end of the day, is not a great experience for most of the employees. So, uh, as you said, rightly said, with technology in our hands right now and communication as the tool, as the focus area that we have, we should be able to ideally nail this in terms of employee engagement and adoption around it.
Yeah, that's a very important point, Chaitanya. You said that it needs to be relevant. If it is
Absolutely.
not relevant to me, I will, if I get continuously daily notification which is not relevant to me, I will stop
Correct.
those notifications. I will put them in silent. So you'll defeat that purpose. So it has
Exactly.
relevant information for me,
Mm.
which may not be relevant for my colleague.
Exactly.
Correct.
Push notifications based on your past history, your experience on the app, relatively engaging you better are the ones that are basically going to take over in terms of how you engage the employees going forward. Great
Yeah.
point there, Amit. Thank you for that.
Yeah.
With that said, another question that I have for you, right? Uh, you have been thinking so much about, how to implement a plan, a program for a population of 4,000 odd employees, and how to engage them, and whether the engagement is, going well, or what are the different ways, etc. Right? That's a lot of effort. I mean, you've basically put in a lot of effort, a lot of thought, around this, right? So how do you measure the effectiveness of the healthcare benefits or the packages that you have rolled out for the employees? And are there any metrics that you use to evaluate the outcome of it?
Yes. A very important question, good question, Chaitanya, because you may do everything, you may communicate also effectively, but then how effective that healthcare program is, that thing is.
Mhm.
I would say that employees' actions matters the most, right?
Mhm.
That's an obvious one. That utilization of a benefit, how the take up is, that gives you an indicator that okay, there's something which is if the take up is less, it gives you an indication that something is not perceived correctly by the employees, and some correction needs to be done. That correction could be anything. That correction could be a benefit design issue, could be simply an awareness issue, could be any other factor which could influence an employee's decision not to take that up, right?
Ab- Yeah.
Like for example, again the preventive health check.
Mhm.
I have seen some of the employees who are afraid to take that because if something negative comes up, they will they will like be stressed about it. So
Got it.
so it could be something which we don't know why this take up is not happening,
Correct.
right? So But yeah, that doesn't mean that the thing is not effective. It's their individual choice. But yeah, we could use some of these indicators which could tell us that something is not working well and there is some correction needed to be done in the benefit design.
Right.
Or the other way could be again the surveys. Like surveys tells us that okay, if we are getting some feedback on something which is already there as an offering, which is a clear indication that the awareness is not there.
Absolutely.
To make people aware that okay, this is something which is available, right? Or there could be something like a childcare benefit, right? People may want childcare benefit, especially in the hybrid working environment where people working from home, they have to manage their children also and then work for the organization also. So there could be feedback coming for a childcare benefit.
Absolutely.
Right. So that could be something which we could look into, right? Then the most important thing to see whether the program is effective or not, it's not only what employees are taking up or not. Is it giving you the return on investment?
Right.
Right. We have designed the program. We have to the best of our abilities, but the take-up is very less. Very less, right? It could be the best of the programs, a must to have, but the take-up is less. Then something needs to be done. So, just look into these data points and then take actions accordingly, depending upon each company, each scenario, what needs to be done. And I would say that keep interacting with the professionals in this area. Keep networking. You would come to know what are the best practices the other individuals are doing to make the right ROI for that benefit, right? Because the dollars are always limited. You
Of
need to
course.
have the best return out of it.
True. Absolutely.
Yeah.
Absolutely. Great point, Amit. One interesting, statement that I want to mention here, during our conversations with multiple other leaders, right? There was this particular organization with employee size of 1,500 odd employees, and they had a recent incident in, their office. One of their beloved employees, had a, sad demise. So they were looking for options of giving the emergency, support services for the employees. One strong statement that has come from the leader is, right, if one life is saved, uh, you know, in the entire year, okay, I don't need the entire population to use it. If one life is saved, my investment in this is, taken care of, right? So, that has basically, sat in my mind, that because that was a very strong and powerful statement that was made. So depending on the kind of benefits that we are enrolling, basically, it has to be, we should be ideally aware of, what should be the ideal kind of adoption that we should be expecting.
Correct.
Understanding it from somebody from the industry, peers will definitely help us understand what should be the ideal expectation from any of the benefits that we are rolling out, and accordingly, ideal call should be taken for each organization. Great.
Yeah, absolutely. Like for example, like an EAP program, you don't expect 10% kind of a take up of that, right?
Absolutely. Yeah.
Yeah. So for an EAP, 1 to 2% take up is good enough.
Hmm. Yeah.
Is optimum, right?
Correct.
It should not go beyond 2% because then it gives you a very different feeling
Yeah,
that okay,
absolutely. Yeah, that's a different problem to solve then.
correct. Then there's a different problem to solve. So obviously, so each benefit will have a different threshold to measure the take up of it.
Absolutely. Absolutely. Great point. I have one last question for you, Amit.
Sure.
So what advice would you be giving for organizations that are just starting to explore the data-driven insights for shaping their employee, health benefits packages, right?
Yeah, I basically summary of what I said. So as I said that first, let's try to consolidate the sources of data so that minimum time is spent in data massaging and all. Then maybe take the data for a year or two, see how the benefits have performed. Does that provide the reasonable flexibility to the varied workforce which we have? across the organization. Use those insights generated from the data as an input to make interventions on the benefit design, or any new design needs to be offered. Once you have done that, then look for a right infrastructure to build, maybe internally, externally, depending upon your particular situation of that organization. You can look into what is the best. I would prefer that if it is a only India outlook, then use somebody externally who have the right expertise to help you in that area. Health, I would say that healthcare benefits space is buzzing like never before, right? There's so many options available. Technology has been like truly disrupted this field with the kind of uh, big players intervention, the money they are throwing it into this area. This market is like innovating almost by the day. If you see, competition is like increasing like anything across all the players. So just explore this domain and see what are the different options are available for you. Keep abreast yourself with the market and the industry movements, I would say. If you do this, I would say your data related issues or technology related issues will get solved, and then you will be like looking much further on how to mm, push the bar up for your benefits offering, and you'll stop worrying about how to manage the current package.
Great. Yeah. Lovely. That's awesome. All the insights that you have shared, Amit, have been so striking. I've been, constantly making a note of everything that you've mentioned that we can adopt and probably start, sharing, publishing with multiple others. And I know we are on the top of the hour from our scheduled, timeline already. So it was lovely interacting with you, Amit, and thank you so much for sharing all the details with us. With that, I would like to, conclude this webinar for today.
Thank you for having me, Chaitanya. It was a pleasure.
It was a pleasure. Pleasure was all ours, sir. Thank you so much.
Thank you, Chaitanya. Bye. Take care.
Bye.